Hi, I'm Taylor Heald-Sargent. I'm an infectious diseases provider at Ann and Robert H. Lurie Children's Hospital in Chicago, Illinois. And I'm going to present to you guys a very brief tour of just a couple select infectious rashes. But first, I wanted to thank transplant families for having me come and present. I love talking to you all and interacting. I know this isn't a live recording, but I'll be around afterwards to answer some questions. And I'm also happy to answer any that come through transplant families later. So with that, let's get going. Now, I want to take you guys on a trip inspired by one of my favorite movies, which is Willy Wonka and the Chocolate Factory. Hopefully no one gets mad at copyrights. But this trip is going to have a couple twists and turns that are not exactly desirable, but you'll see. So I want you to imagine that you got your golden ticket and you're going into Willy Wonka's chocolate factory. And in this chocolate factory, you see just the amazing world with candy on both sides. And there's an Oompa Loompa leading you around towards a waterfall gushing over with red candy and liquid. As you get closer, the Oompa Loompa leans in and the top of his head gets splashed by that waterfall cascading down the mountain. You think that's really cute. And you think, hey, maybe I want to get in this waterfall. Until you take a closer look at the Oompa Loompa, and actually a bunch of the Oompa Loompas that have gone in this waterfall, and they don't quite look right. The rash, where you thought it was just the cute waterfall, is actually it's a rash with red bumps going all the way from the top of their head down. And now even their eyes look red and runny, and their nose is running. They have some red spots in their mouth. They're starting to get high fevers measured by their really cute candy cane thermometers. And they're just not feeling well. In fact, this one stops smiling pretty soon after that. So think to yourselves for a second, what kind of infection did this Oompa Loompa get? And definitely don't go in the waterfall. So to summarize, it has a rash coming down from the top of the head, a high fever, red eyes, a runny nose, cough, and they're really not feeling well. And I don't expect you to memorize exactly what these rashes are associated with, but I just want to give you an idea because I know as a parent, I sit at home and I'm trying to figure this out on my own before I call my doctor. So just so that you can have some thoughts and when to be worried and when to not. So this, I'm trying to give an example, of course, using an Oompa Loompa, of a measles infection. And with measles being so prevalent in the news recently, we thought it would be a good idea to give people an overview of what this might look like. Because I know I've had the question in my mind of like, could this kid have measles? So maybe this will help you think about it a little bit. So in general, the initial infection of measles is characterized by having that high fever, malaise, which is just generally feeling unwell. These guys are just really miserable. They also have a cough and red eyes and runny nose. So I like to think about it as the infection got a bucket that got poured on top of the head, or you walk through that waterfall and everything is just coming down. The rash is coming down, the eyes are dripping in red, and the nose is dripping, and they're just feeling, ugh. So that's the typical progression of what measles would look like. Here are some images of what the rash would look like on the skin. And I will acknowledge that this skin type does not reflect all skin types, but this was a representative image on the CDC website. You know your child the best and what a rash looks like on them. The picture of the mouth are these things called Koplik, which are sores in the mouth or like lesions or little white spots in the inside of the cheek that can be present even before the rash. They can be a really early sign. Totally don't expect anyone to notice them, but I'm putting them out there because you might see that on websites when they mention Koplik spots, but they're kind of hard to figure out. Now, I mean, being sick is not fun, and having measles is certainly miserable, but what actually are the complications of it, and why do we care so much? Why is measles so dreaded? And luckily, a lot of people don't remember these complications because it's not as common anymore. But measles really, really knocks out your immune system. So it makes you susceptible to a lot of other infections, especially other bacterial infections. So these bacterial infections can cause pneumonias or ear infections, croup or diarrhea. And I'd say these aren't that uncommon. A lot of kids, because we've unfortunately seen some in the hospital recently, will have some of these secondary infections. But some of these bacterial infections we can treat with antibiotics. Others, there's not much we can do about, and they're really the troublesome ones. One of those is that measles can cause an encephalitis, which 1 out of every 1,000 children with measles can get. And it can cause death in about 1 to 3 out of every 1,000, usually because of the respiratory disease with the pneumonias or the brain infections. And particularly terrifying to me is this last entity called subacute sclerosing panencephalitis, or SSPE, which is a mouthful basically saying that it's a degenerative brain disease and it happens years after infection. Luckily, that's rare, but there's absolutely nothing we can do at that point. And so that's why it's really important that we prevent people from getting measles. Now, I recognize that a lot of you may have children who have solid organ transplants or other immunocompromising conditions, and they might not have been able to have their full vaccine series because measles is part of the MMR vaccine, which is a live attenuated vaccine. Not everyone with immunocompromising conditions can get it, or were able to get it before they got that immunocompromising condition. So what can you do for them to prevent the infection if they've been exposed? So there is something that you can do. And so therefore, if you are exposed or your child exposed, we would love for you to reach out to your healthcare providers to see, and especially in a timely manner. I really want to highlight that because time is of the essence in getting some of these interventions. So typically the measles rash can appear 14 days after exposure, and people can be contagious or can be infectious days before the rash appears and days after. So you might not find out right away that you were exposed to measles, but it is extremely contagious. And one of the other particularly nasty things about measles is someone in a room coughing can leave the room, but those viruses stay for up to 2 hours. So just more reason to try to make sure everyone that can get the vaccine ahead of time does. But if you're a non-immune person, so someone that might not have been able to get the full vaccine series or have other evidence of immunity, if you're exposed, you might be able to have what we call post-exposure prophylaxis. And that's where you can get immunoglobulins or antibodies after you've been exposed. Or if you're not immunocompromised, if you have a normal immune system, you can get that vaccine after the fact, and that can help protect you. So just wanted to put that out there to say, remember to call your healthcare provider. And just to allay fears, measles is not spreading widespread across the country. We just want to say these things because we know there are questions out there. You also don't need to avoid hospital settings. There's plans in place to keep people from getting exposed in hospitals. And it's always fine to call your doctor and just say, hey, I'm worried about this. Can you talk to me about your prevention measures? Okay, so that wasn't really a fun room in the candy shop, but let's move on to that experimental room where they come up with new candies and hopefully we won't turn into blueberries. So you're walking along and you see this Oompa Loompa and he's so cute and he's playing around with all the candies. He's actually getting them dirty. Wonka's not going to be happy with him. He's on the conveyor belt and he noticed that the red candies are kind of bouncing off the conveyor belt and hitting him in the belly. You think that's adorable until you notice, oh no, this one's also sick. It's a little bit different though. This time the rash, it started on the belly or the trunk, the chest area, and then it went to other places. He also has a fever, might not be as high. He's also tired and just doesn't feel like eating and has a headache. So I'll give you guys a chance to think, what might this be? So what I'm trying to show in that is someone that has varicella or chickenpox infection. And I wanted to highlight that because Measles and chickenpox, both vaccine preventable, both luckily less common in the United States, pretty rare actually. And so it's something that people might not be familiar with figuring out. So the measles went over the head, the chickenpox usually starts here and then goes outward. So it's a different pattern of the rash emerging. And it also, the rash looks different. So if you see on this image here, the rash in this child at a couple days into infection has lesions that look different. They're not that all the same red dots across the body like we saw with measles. These have some that are flat, that are small, some that have vesicles, which are fluid fill lesions. Others might have even popped open and got some crust all over them already. And that's characteristics of chickenpox. You have different types of dots as the rash evolves. So they kind of the age, so to say. So this can also have complications, although typically less severe than measles, but it can have bacterial infections. Again, you can actually have a viral pneumonia, and you can again have brain involvement. Something that most people have probably heard of or thought of is shingles. And that's a complication that happens years later. So varicella is a herpes virus, which herpes viruses all hide in the nervous system and come out during times of stress. And so shingles is that herpes virus coming out, and it causes painful rash as opposed to an itchy rash of primary chickenpox. So you have a painful rash. Usually that rash is just local. It's one area. So it might be just coming down your neck or just on your arm or just on your chest. But in some people, especially ones that might have immunocompromised or pregnant people, shingles, the reactivation can be more disseminated. So it can be in multiple areas. It can also go to your organs, like your lungs or your liver or your brain. So again, we'd love to prevent this infection. We don't want it. And there is a way, vaccination. But again, the vaccine for chickenpox is a live attenuated virus. And so it's not always recommended for people with immunocompromised or salad organ transplants. So what can you do if you've been exposed to chickenpox? Again, the rash takes a while to show up after exposure. And this has a specific definition of exposure for chickenpox. And there's a whole algorithm that when you call your healthcare provider, they would go through to see if you meet these criteria, just to give you an idea of what we would consider significant exposure. If it's someone in the household that has primary chickenpox, if it's a playmate, so another child that some people say over 5 minutes, some people say over an hour of face-to-face contact, like so daycare person has chickenpox. If they're newborns, or if you have contact with uncovered lesions, like if you're hugging someone that has that shingles that are open and you touching them, but again, probably a household member at that point. So those would be considered significant exposures. If you or your child have had those and you're not immune, or you have an immunocompromise and at risk of getting more serious infection, there are things we can do. It's mainly using IVIG or as a second line, and primary would be Varizig. So it's varicella immunoglobulin. So that's specific antibodies against the varicella virus. So that's a chickenpox virus. IVIG can be given in certain situations if you can't get Varizig or if you're already getting it for other purposes. And then some providers will use acyclovir if they can't get those other options. Just putting that out there, but primarily we would use Varizig as post-exposure prophylaxis for chickenpox. Okay. Last room. I know at this point you probably don't want to go into any more rooms. This room is one of my favorites as a child. It was the old-fashioned, the TV room. And instead of going on TV, in my version of this candy factory, that's a horrible version, I would never want to go in. I don't want this golden ticket. But in this version, they're actually just watching old televisions. And while they're watching it, unfortunately, because of the magic of Wonka, one of them can track something that's on that old television. So this poor Oompa Loompa has a high fever, headaches, and body aches. And this one's rash, it started as sores in the mouth and then kind of came out from there, and especially went on the arms and the legs and the hands. So instead of being dumped over or spread right here, kind of came out and went all the way to the tips. I don't expect anyone to get this one, but just thinking about it, old-fashioned virus and fever rash. So this one got smallpox, but that's not around anymore, which is why he only got it from watching that old-fashioned television. Smallpox has been eradicated, which means that it's no longer circulating anywhere in the world. And that's amazing. It's something that we can only do with certain pathogens. It's only been done twice in the history of the world so far, but we're trying it with others. There's a whole long list of criteria that pathogens have to meet if they're able to be eradicated, such that they're caused by an infection and you have a way to prevent that infection, and the infectious particle isn't stored in some sort of animal reservoir. Animals aren't going to propagate it or something like that, where it's really in humans. And anyway, basically smallpox met all of these. And over the last century, it was able to be eradicated throughout the world, which means it's not actively replicating or spreading in the population. Another way to represent this is to look at smallpox cases over the past century. And you can see that in the early 1900s, we have a number of smallpox. And then as the vaccination protocols got better and as we were able to step up eradication, it's been eradicated for many years. But I bring up smallpox just to say that history always repeats itself, and to remind people that similar to today, even with smallpox, this vaccine that was around for hundreds of years, there was hesitancy amongst the population to get this immunization. And you can see some of the political cartoons depicting doctors as giving people, their victims, inoculation, and then those victims turning into pigs or coming down with other terrible things, or talking about how it doesn't work and we shouldn't do it and it's inflicting personal liberties. All of these arguments that you might recognize from some of the people that are concerned about the vaccines today. But these were able to be overcome, and we were able to eradicate smallpox. Now, thinking about measles and chickenpox. So measles has been eliminated in the United States, meaning it's not usually spreading locally within our population, but it's not eradicated. It's still present around the world. It can still be brought here. It still can circulate in pockets of people that don't have good natural immunity. And you need to have more than 95% of people in a community need to be protected to prevent local spread. And unfortunately, in US kindergartners, there was a decline between 1999's class that entered in 2022 to go below that 95% threshold. It went from 95.2 to 93.1%. And this year, over 36 states have kindergarten classes that have less than 95% protection. So this is setting us up for an environment, communities that are ripe for measles to spread. This isn't just measles. It reflects other prevented immunizations and vaccinations. So you can see here, we were doing a good job of getting people protected against a lot of deadly infections. Measles is in red. And then over the past decade, and especially over the past 5 years, there's been a decline in vaccination rates. So we really need to work on this, and we can. We overcame it with smallpox. We can do it for measles. Chickenpox, just a quick update. It's kind of the baby in the vaccine family. The vaccine was released in the United States in 1995, but since then, over 91 million cases have been prevented and 2,000 deaths. So just putting out there, it's important. Make sure people that can get vaccinated do. So try to encourage anyone in your community that can get the vaccine to get it, to protect those people that can't, so we can have high immunization rates. I hope today that I have allowed you guys to better distinguish between the rashes of measles and chickenpox, and hopefully you won't see either, but now you would know what to be on the lookout for and when to call your doctor right away, because there might be something you can do about it if you've been exposed. If you notice that Playmate has this rash and it sounds like it could have been measles, and it's proven to be measles, call your doctor. And then I also just wanted to review with you all and have you guys understand that vaccines are very important. The general population need to be reminded of this all the time because we have waning rates overall. And really, it's the best way to eradicate these pathogens. With that, I'll take any questions. Thank you very much.
Thank you very much, Dr. Heald-Sargent. I appreciate you coming to us and speaking to us today. You always do a fantastic job. I'm going to ask just a couple of questions, and then we'll let the group ask questions as well. Anyone that doesn't have questions answered today, just send them to hello@transplantfamilies.org, and then we'll make sure to send them on and they'll be answered at a later time. My question today was, given over the past 10 years, it seems as if prior research had showed a much higher death rate for some of these ailments. So it was kind of nice to see only 1 to 3 deaths out of 1,000. Like we've read things as parents that say, oh, it was a third. And so that, of course, freaks us out entirely. So it seems like there's been a progression. I didn't know if you wanted to speak to that and just the advancements in technology for treatment.
So, yes and no. I think some of it has to do with just how we're able to improve health overall. So, for measles treatment, there's not really treatment per se, but we know that the nutritional status of an individual plays a big role. In fact, if a person gets infected with measles, the one thing we do give is vitamin A. And so that has helped just overall having healthier individuals. Also, we're in a different environment than we were back in the day with different medical care and technologies that can help people through acute infections. And so it's a different population than we had 50 years ago. Although the death rates in general still are similar once you get to the severe end of infections.
So it's very important that if we see a skin rash of some kind, that we contact our transplant team immediately, so that they kind of know what's going on and they can direct us to the right place to get immediate care. Correct.
Yes, and I would say just knowing what's going around in your community. I mean, measles usually isn't going around. It's not something you want to be you have to be thinking about. Same with chickenpox. But if you hear it on the news and you're concerned, this might be able to help you because I know kids get rashes for lots of reasons to either feel better or know that you should probably reach out to your doctor.
That's great. My son's a wrestler, so he often gets rashes, but thank goodness it hasn't been any of those. um, Thank you so much again. We appreciate it. We appreciate your time today and always giving us a fantastic presentation. This was really great, and to help us see some of the signs of these really scary rashes that we see out in the news a lot, and to help assuage some of our fears. Thank you so much again, Taylor.
You're welcome. Thanks.